Hello dear students, I'm Rikta. Welcome back to Medicine Nursing. I know many of you still feel confused when it comes to understanding the menstrual cycle, especially the sequence of hormonal changes, the different phases and how they all connect, right? But don't worry, in today's sessions I'm going to break it down again in a very simple, easy to understand way. And not just that, along with that, I have enlisted all important one-liner questions that are highly expected in exams. So make sure you watch till the end and note everything carefully. Let's clear the confusion once and for all, okay? So in the previous sessions, I have discussed regarding this menstrual cycle in detail, where I told you that this menstrual cycle is a cyclical bleeding occurring in reproductive female age between 15 to 49 years at regular interval, and it's a physiological process. So if a reproductive female age between 15 to 49 years come to you and complaining that in every month I'm getting bleeding which comes through vagina, then you will assure her that it's completely okay at her age. If a woman at age of 60 years or 70 years comes to you and complaining about the same problem, like I'm having bleeding through vagina, then that can be a pathological reason. But if a woman coming to you at her reproductive age between 15 to 49 years and complaining that at regular interval I'm getting bleeding through vagina, then that is a physiological process. Can you understand? So it's a physiological process, and the average duration of this menstrual cycle is 28 days, and the bleeding stays for 2 to 8 days, on an average 4 to 6 days. Okay. So average blood loss through this menstrual cycle is 35 ml and ranges from 50 to 80 ml. And this menstrual cycle is having total 4 phases. I have discussed that: menstrual phase that stays for day 1 to day 5, follicular phase that stays from day 1 to day 13, ovulation phase that exclusively stays on day 14, and luteal phase that stays from day 15 to day 28, approximately 14 days. Okay, this luteal phase. So menstrual phase, menstrual cycle, that is average duration day 1 to day 28, and this whole menstrual cycle we have divided into 4 phases. One is your menstrual cycle, second one is your follicular phase, third one is your ovulation phase, and fourth one is your luteal phase. Now coming to this menstrual phases. Okay, so before that we told that your whole menstrual cycle is depend on the concept of your FSH, LH, estrogen, progesterone, their level, and the positive and negative feedback of each hormone on anterior pituitary. So these 3 concepts if you understand, then the whole menstrual cycles, there will be no problem for you to understand. So coming to the first phases, that is your menstrual cycles, okay, or menstrual phases. The first phase of menstrual cycle is your menstrual phase, that is the bleeding phase, okay, and that stays for D1 to D5. If there is less estrogen and less progesterone, then only this menstrual phase will come, bleeding phase will come. Why? Because this estrogen is responsible for proliferations of your uterus. So if I ask you, proliferations of uterus is responsible for which hormone? Which hormone responsible for proliferations of uterus? Your answer will be estrogen. And that question came in exam. If I ask you, which hormones support the uterus at secretory phase? What will be your answer? Progesterone. So both are putting the lining or giving support to the uterus. If those hormone level is less, then there will be no one to support the uterus. Then only bleeding will occur from this uterus, shedding of the uterus, lining of uterus, and then bleeding will occur. So menstrual phase occurs when the estrogen and progesterone level will be less. Then only no endometrial gets supports, shedding of uterus occurs, and then bleeding through vagina you can see, and that is called the menstrual phase, and that stays from day 1 to day 5. So what questions come from what one-liner questions having the possibility to come in exam from this menstrual phase, from the first phase of your menstrual cycle? So if I ask you, menstrual cycle begins with which phase? So menstrual cycle, this is your menstrual cycle from day 1 to day 28. So menstrual cycle begins with which phase? Your answer will be menstrual phase. That is the first question. If I ask you, what marks the end of menstrual cycle? ओके कैसे समझ आएगा कि मेंस्ट्रुअल साइकिल खत्म हो गया, इस मंथ का मेंस्ट्रुअल साइकिल खत्म हो गया? सो यू विल अंडरस्टैंड ओनली व्हेन द नेक्स्ट मेंस्ट्रुअल साइकिल विल बिगन, मीन्स द नेक्स्ट bleeding phase will start. Then only you will understand that okay, this is the mark that the previous menstrual cycle gets ends here. Understood? Now the third question is, if I ask you average durations of menstrual bleeding, what will you answer? You will answer 4 to 6 days. It ranges from 2 to 8 days, but average if they will ask, you will answer it as 4 to 6 days. Okay. If they ask average blood loss through this menstrual cycle, your answer will be approximately 35 ml, and the ranges is 50 to 80 ml. Okay. If they ask menstrual bleeding results from shedding of which layer? Okay, then you will answer C. Here this uterus endometrial is having two layer in the endometrium. Here two layer is there. What are those layer? Those layer are two layer of endometriums. Two layers of endometrium. One is zona basalis, and another one is superficial layer. This superficial layer also called stratum functionalis. Okay, so here is your zona basalis, and above that this one is your superficial layer. This superficial layer each month getting shades off. Shading of this superficial layer leads to bleeding. Okay, so if I ask you menstrual bleeding results from shading of which layer, you will answer it as the stratum basalis or superficial layer. This is the answer. Okay, if I ask you menstruations occur due to withdrawal of which hormone, then your answer will be, here will be the answer of, at the end I discussed in previous day that the last phase is luteal phase, and in that luteal phase corpus luteum secretes. Where is that? Corpus luteum. This ovum release, and then the remaining portion is called corpus luteum. This corpus luteum secretes progesterone. So if corpus luteum dies, then progesterone will be less, then there will be no support, there will be no one to support the uterus. As a result, again next phase of bleeding will start. So if I ask you menstruations occurs due to withdrawal of which hormone, your answer will be progesterone hormone. Okay, so if I ask you first day of menstrual cycle or first day of menstruation corresponds to which hormone level, your answer will be this one. Low level of estrogen and low level of progesterone. Why? Because if there is low level of estrogen, if there is low level of progesterone, there will be no one to support the endometrium. As a result, shedding of endometrium will occur. Hence, bleeding will come through vagina. So that will be the answer. If I ask you first day of menstruation corresponds to which hormone level, your answer will be low level of estrogen, low level of progesterone. Okay, so we will enlisted one by one all the questions here. Menstrual cycle begins with which phases? Your answer will be menstrual phase. The first phase, okay? Menstrual phase. What marks the end of one menstrual cycle? Your answer will be onset of next menstruation. Next menstruation, okay? Average duration of menstrual bleeding? Answer will be 4 to 6 days. Average blood loss? On an average 35 ml is the best answer, okay? Menstrual bleeding results of shedding of which layer? So I told you here is total two layer. One is zona basalis and another one is superficial layer. Okay, superficial layer. This superficial layer, another name is stratum functionalis. So shedding of this layer leads to bleeding during your menstrual phase. Okay, bleeding. So menstrual bleeding results from shedding of which layer? Your answer will be superficial layer or stratum functionalis. Okay, menstruation occur due to withdrawal of which hormone? Your answer will be progesterone. Why? Because there will be no one to support the uterus. Low level of progesterone. Due to the low level of progesterone, there will be no one to support the uterus. As a result, bleeding started. Shedding of uterus will start. First day of menstruation corresponds to which hormone level? What I answered? Low level of estrogen and low level of progesterone. That's all about your menstrual phase. Okay, so I have discussed in detail about this. Menstrual phase means that is the first phase, and all possible one-liner questions that having high chance to come in exams I have enlisted here. Now coming to the second phase. What is the second phase? This is your second phase, that is follicular phase. Okay, this follicular phase stays from day 1 to day 13. This is the follicular phase, right? That stays from day 1 to day 13. Understood? Now at this follicular phase, what happens? This is regulated. This follicular phase is regulated by HPO axis. HPO axis stand for hypothalamic pituitary ovarian axis. So hypothalamus, pituitary and ovarian all plays a crucial role to maintain this follicular phase. What they are doing, once the female attains the puberty, this HPO axis, hypothalamo-pituitary ovarian axis gets activated. Okay, first hypothalamus will act, then the message get from hypothalamus pituitary will act, then the message from pituitary ovary will act. Okay, one by one, stepwise they will act. How they will act? First, hypothalamus become active. Hypothalamus release GnRH. GnRH means gonadotropin releasing hormone. Okay, this gonadotropin releasing hormone send message to anterior pituitary. Send message to anterior pituitary. What messages? That release follicle stimulating hormone. This anterior pituitary release two hormones. One is follicle stimulating hormone, one is LH hormone. Now LH, that means luteinizing hormone, is not having any role in that follicular phase. So we won't think about this LH hormone now. So we will focus on that FSH, follicle stimulating hormone. In that name itself, it is written as follicle stimulating hormone. So this is the kind of hormone which stimulates the follicle. Where is your follicle present? You can think now, where is your follicle present? So you will say, ki ma'am, follicle present inside the ovary. Inside the ovary, there is two region. One is the outer portion, we will call it as this portion. This portion called as ovarian cortex, and this one is your ovarian medulla. So in this cortex region, you see, in this cortex region, there are many follicles present. So what are those follicles? Here is your primordial follicles, here is your primary follicles, secondary follicles, graphium follicles. So the influence or the effect of this follicle stimulating hormone, primordial follicle turns into primary follicle turns into secondary follicle turns into graphium follicle, and they are getting mature one by one. Primordial follicle is the immature one and the graphium follicle is the matured one. So the influence of this follicle stimulating hormone, this immature follicle turns into mature follicle. After that, what they will do? They will secrete this estrogen. This estrogen is having a very important functions in this follicular phase. So if I ask you, which hormone is having crucial role in follicular phase, means the second phase of menstrual cycle, your answer will be estrogen. You should not think about, or you should not have any doubt regarding that. Your answer will be estrogen hormone. So estrogen is having total 3 functions in that phase, means in follicular phase. What are those functions? The function will be, estrogen will send the negative feedback to your anterior pituitary. What is the negative feedback? That decrease the FSH hormone. Why? Because this hypothalamus continuously secreting GnRH. As a result, anterior pituitary releasing follicle stimulating hormone. Now follicle stimulating hormone stimulates all the follicles, and all follicles secretes estrogen. Now there is a lot of estrogen inside the body, right? So it will send the all hormones is acting, mostly they are acting on negative feedback mechanism. So this estrogen will send message to anterior pituitary that enough is enough. Now no need this follicle stimulating hormone anymore. I am enough now. So he or she, whatever it is, so estrogen will send the negative feedback to the anterior pituitary. This follicle stimulating hormone should be decreased. Okay, now the second function is, this estrogen will send the positive feedback on anterior pituitary. For what? For this LH hormone. As a result, LH will get increased. Okay, so negative feedback on FSH, as a result FSH will decrease. Positive feedback on LH, as a result LH will increase. As a result LH surge will occur. Okay, LH surge. This LH surge is important at ovulation phase, so it will come later phase. And the third function of estrogen is to proliferate the uterus, because at menstrual phases there is shedding of uterus, right? Now it needs supports, because continuous shedding of this uterus will leads to continuous bleeding. But during the menstrual cycle, on an average 4 to 6 days bleeding phase will be there, stays for 4 to 6 days. After that, due to the effect of estrogen, uterus gets proliferate. As a result, bleeding will stops. Understood? So these 3 functions is for this estrogen. Okay, then this will end up the follicular phase. So what you understand through this follicular phase? Follicular phase is initiated by your HPO axis. Hypothalamus secretes GnRH. GnRH sends the message to the anterior pituitary. As a result, anterior pituitary will secrete FSH. FSH means follicle stimulating hormone. In that name itself, it is mentioned that follicular stimulating hormone means this is such kind of hormone which stimulates the follicle. What? After getting stimulation, what those follicle will do? They will secrete the estrogen. This estrogen is the crucial hormone at your follicular phase. So what are those crucial functions? It acts on FSH by negative feedback mechanism. As a result, FSH will get decreases. It acts on LH by positive feedback mechanism. As a result, LH will increases. So LH surge will occur, and it will proliferate the shredded uterus, so that bleeding will get stopped, and the uterus will proliferate its layer, and uterus became thickened. Okay, so that's all about your follicular phase. Now if I ask you, see, this is your total menstrual cycle day 1 to day 28, and this is the day 14. that is your ovulation phase. So this first 14 days we will call it as ovarian cycle, okay, and this last 14 days we will call it as uterine cycle. You have to remember this. Now if I ask you ovarian cycle means the follicular phase, this ovarian cycle is initiated by which hormone? What will you answer? You will answer it as this FSH hormone, okay. This FSH is having important role to initiate the follicular phase, because once this FSH will act on follicle, it will secretes estrogen. Those follicle will secrete estrogen, and this estrogen is the main hormone at follicular phase. But which hormone initiates the follicular phase or ovarian cycle? The answer will be FSH. Understood? Now, which hormone responsible for endometrial proliferation? I told you before that this estrogen is having important function to proliferate the uterus. So if I ask you which hormone responsible for endometrial proliferation, your answer will be estrogen, okay. If I ask you follicular phase is dominated by which hormone? This one, estrogen. If I ask you follicular phase is initiated by which hormone, your answer will be FSH. Both are different questions and having different answer. Main hormone is estrogen, but initial hormone is FSH. You just imagine, if FSH is not there, then who will secrete estrogen from follicles? Obviously answer will be FSH na. This is the initial hormone. So follicular phase is initiated by FSH hormone, and the main hormone in follicular phase, your answer will be your estrogen, okay. So hormone initiate follicular growth, answer will be your FSH, okay. So from where this FSH is secretes? From where? This is the hypothalamus. It secretes GnRH. GnRH sends message to anterior pituitary. Anterior pituitary gets the message and it secretes two hormones, FSH and LH. So what is the source of FSH and LH? Your answer will be anterior pituitary. From where GnRH release? Your answer will be hypothalamus. Understood? What is the source of estrogen in the follicular phase? Means from where this estrogen is released? Estrogen released from those follicles. Primordial follicles, primary follicle, secondary follicle, Graafian follicle, all follicles secretes the estrogen. So what is the source of estrogen in follicular phase? Your answer will be developing follicles, or all kind of follicles secretes the estrogen, okay. Which phase is variable in length? This menstrual phase is menstrual cycle is having total 4 phases, right? Menstrual phase, follicular phase, ovarian phase, and your luteal phase. So luteal phase is the constant phase you have to remember. Follicular phase is the variable phase you have to remember. If a woman is having 40 days of menstrual cycle, her follicular phase will be different from the woman who is having 35 days of menstrual cycle. Her follicular phase will be different from the woman who is having 28 days of menstrual cycle. But no matter how many days of cycles, whether it is 40 days, whether it is 35 days, whether it is 28 days, all will be having 14 days of luteal phase. So luteal phase is constant for all women, but follicular phase is variable depending on the interval of this menstrual cycle. So if I ask you which phase is variable in length, your answer will be follicular phase. If I ask you which phase is constant in menstrual cycle, your answer will be luteal phase or secretory phase, okay. So that's all about this follicular phase. So I discuss about all the questions, possible one-liner questions from this follicular phase. Now again we will enlist it here, okay. So what I told you, ovarian cycle is initiated by your whole menstrual cycle, D14, D1, D28. So first 14 days is your ovarian cycle, that is your follicular phase, that initiated by your follicle stimulating hormone. This is the initiated hormone, okay, initiated hormone. But the main hormone is your estrogen, okay. That is totally different questions having different answer. Hormone responsible for endometrial proliferations, your answer will be estrogen, okay. Follicular phase is dominated by which hormone? Again the answer will be estrogen. This is the main hormone, that is why it is a dominant hormone at this phase. Which hormone initiates follicular growth? You will answer it as FSH, because anterior pituitary secretes this FSH. This FSH acts on follicles, then those follicles secretes estrogen. So who is the initial hormone here? This FSH is the initial hormone here. It initiates the follicular growth. Site, this will be the site of FSH and LH secretions. Your answer will be anterior pituitary. It secretes the FSH and LH. GnRH secrete from which part of the brain? Answer will be hypothalamus, okay. Hypothalamus secretes GnRH, it sends message to anterior pituitary, then anterior pituitary secretes FSH and LH. So source of FSH and LH, answer will be anterior pituitary. Source of hypothalamus, answer will be, source of GnRH, answer will be hypothalamus. What is the source of estrogen in follicular phase? So primordial follicle turns to primary follicle turns to secondary follicle turns to tertiary follicle or graphium follicle, and all secretes your estrogen. So what is the source of this estrogen? Answer will be developing follicle. Okay, developing follicles. Which phase is variable in length? What I answered? Answer will be your follicular phase. Okay, which phase is constant in length? Answer will be your luteal phase. It's always 14 days. Okay, 14 days. But if a woman will be having 40 days of cycle, if a woman will be having 35 days of cycle, if a woman will be having 28 days of cycle, all will be having different follicular phase. That is why it is variable phase. Okay, now thin stretchy egg white cervical mucus appears due to, your answer will be estrogen. Due to estrogen hormone at follicular phase, the cervical mucus will be thin, stretchy and egg white. This is called Spin-Burkitt sign. Spin-Burkitt sign. If you examine this cervical mucus on microscope now, it will see as thin, stretchy, egg white like structure. It is due to estrogen hormone. But if your cervical mucus is thick, viscous, non-elastic, non-stretchy, that will be due to the progesterone hormone. So Spin-Burkitt sign is due to estrogen hormone, and the cervical mucus is thin, stretchy, egg white, and due to progesterone, cervical mucus characteristics is like thick, viscous, non-elastic, non-stretchy. Okay. Now that's all about your follicular phase. Now coming to the third phase. Okay, that is your ovulation phase. So we have discussed here the menstrual phase, we have discussed here the follicular phase. Coming to the ovulation phase. Okay, this is the ovulation phase, that is the third phase. So ovulation phase is occur on the day 14 of cycle. Okay, at that stage, this mature follicle gets ruptured and it releases the secondary oocyte. Inside this mature follicle, primary oocyte turns into secondary oocyte. This secondary oocyte is nothing but ovum. So releasing of ovum from mature follicle on the day of D14 of menstrual cycle is called ovulation. Okay, this ovulation is due to this LH surge. LH surge occurs due to the positive feedback effect of estrogen on anterior pituitary. At follicular stage, estrogen release, it's showing its negative feedback on FSH, as a result FSH decrease. It's showing its positive feedback on LH, as a result LH increases and it reaches at a peak level. We call that peak level as LH surge. Due to this triggering effect of LH surge or the high level of LH hormone only, mature follicle gets ruptured and secondary oocyte release, and this is exclusively we are calling it as ovarian phase or ovulation phase. So due to the influence of LH surge, secondary oocyte from Graafian follicle release along with first polar body, we will call it as ovulation phase. So what things or questions you need to remember? If I ask you ovulation is triggered by which hormone, your answer will be this LH hormone or LH surge. Okay, due to this LH hormone, ovulation is occurring. What causes the LH surge? What will you answer? How this LH surge occurs? The cause is the high level of estrogen, continuously secreting estrogen, showing its positive feedback on LH. As a result, LH surge occurs. So if I ask you, LH surge occurs due to, your answer will be positive feedback of estrogen or high level of estrogen. Okay. If I ask you, if a mother is having total 28 days of cycle, menstrual cycle, okay, menstrual cycle, then when this ovulation will occur, you will answer it as D14. On the day of 14th, ovulation will occur. Okay. If I ask you what structure ruptures to release ovum, what will you answer? This mature follicle. Mature follicle gets ruptured, Graafian follicle or mature follicle, and release its ovum. Okay. If I ask you during ovulation, what happens to the basal body temperature of a female? You will answer it as increases. During ovulation, sudden increase in body temperature and then it's drop. Okay. Means the basal body temperature will increase during your ovulation. If I ask you this positive feedback and negative feedback, if I ask you estrogen showing is positive feedback to whom? If I ask you estrogen is showing negative feedback to whom? What will you answer? So estrogen showing positive feedback on LH, that's why LH surge occur. and estrogen showing negative feedback on FSH. That's why FSH gets decreases. Okay. So positive feedback and negative feedback on which hormone you need to remember. So if I ask you what is the main functions of this LH, this LH surge is occurring because of ovulation. Okay, so for occurring this ovulation, LH level should be increased. LH should reach its peak level. Due to this LH surge only ovulations occur. So main functions of LH in female body, you will answer it as ovulation. And once this ovulations occurs, this remaining portions of graphium follicle, we call it as corpus luteum, right? Corpus luteum. So the main functions of LH in female body is occurring ovulation and corpus luteum formation. That's it. Okay. So what things you need to remember, we will enlist it here. Let's enlist it here. If I ask you ovulation is triggered by which hormone, what will be your answer? Your answer will be LH surge or high level of LH. Okay. If I ask you what cause of LH surge, what will you answer? Positive feedback of estrogen or high level of estrogen. Okay, high level of estrogen showing its positive feedback of LH on anterior pituitary. As a result, LH reaches its peak level and we are calling it as LH surge. Okay. If I ask you ovulation occurs on which day in 28 days of cycle, you will answer it as 28 minus 14. Answer will be on D14. If I ask you if a woman is having 35 days of cycle, then ovulation occurs on which day? Your answer will be 35 minus 14. That means D11. Okay. If I ask you if a woman is having 40 days of cycle, when ovulation will occur? Your answer will be 40 minus 14. So 26. D26. Day 26. These ovulations will occur. Okay. Like that you have to answer. If I ask you what structure rupture to release this ovum? So match your graphium follicle. This graphium follicle gets ruptured and release secondary oocyte. So what will be the answer? What structure rupture? Answer will be your graphium follicle. Okay. If I ask you what happens the basal body temperature after ovulation, you will answer it as increase. First increase, then sudden drop. Okay. So first answer will be your increase. Estrogen has positive feedback on your LH, and that is why LH surge occurred. Estrogen showing its negative feedback on FSH. That's why FSH gets decreased. Okay. So main functions of LH in female. So you will answer it as ovulation. Because of LH surge only ovulations occur, right? Ovulations and corpus luteum formation. Corpus luteum formation. What is this corpus luteum? I told you. This graphium follicle gets ruptured and release secondary oocyte, right? This remaining portions of graphium follicle call it as corpus luteum. This corpus luteum secretes progesterone. This progesterone is the main hormone at last phase of menstrual cycle, that is in your luteal phase. So for that, corpus luteum formation is important. So what is the functions of LH hormone? Ovulation and corpus luteum formation. Okay. Now that's all about your luteal phase. Again, we will come in the last phase of your menstrual cycle. That is your luteal phase. Okay, so we cover menstrual phase, we cover follicular phase, we cover ovulation phase, and the last phase is your luteal phase. Luteal phase means here the graphium follicle at ovulation phase, due to the effect of LH surge, it gets ruptured, it releases its secondary oocyte, and the remaining portions we call it as corpus luteum. This corpus luteum now plays an important role at luteal phase. This corpus luteum secretes progesterone. This progesterone is very important during your pregnancy. So this corpus luteum releasing the main hormone progesterone. Along with that, it also secretes estrogen also. It also secretes inhibin also. But the main hormone released from corpus luteum is your progesterone. Okay. Now you need to remember what is the functions of progesterone at luteal phase. This luteal progesterone is having mainly two functions. One is it supports the uterus. Why it supports the uterus? Because once this ovum release, now sperm will fertilize this ovum. Then zygote will form. This zygote needs implantation. Okay. For implantation, a good environment in uterus needed. So for making a good environment, this uterus needs supports. For getting support in uterus, progesterone is important. So you understood, this progesterone is the main hormone during pregnancy for implantation purpose. Okay. So one function is this, and another functions of progesterone is it's showing, if let's think there is no fertilizations occur, ovum is released. Now the remaining portion is corpus luteum. Corpus luteum secretes progesterone. Now continuous progesterone secretion is not possible, right? So because next cycle also need to be initiated at the next month in female reproductive age. So progesterone will sense the negative feedback on anterior pituitary. As a result, LH will get decreased. If LH get decreased, due to LH hormone only corpus luteum works, na? Now, if LH decreases, corpus luteum also decreases. If corpus luteum decreases, progesterone will decreases, because corpus luteum only secretes progesterone. If there is less progesterone, then there will be less support to uterus. If there is less support to uterus, shedding of uterus occurs. If there is shedding of uterus, means there will be bleeding from uterus. If there is bleeding from uterus, means the next cycle will start. Next cycle will start. See how amazing next cycle start. How amazing this female reproductive physiology. I really feel good when I'm studying this OBG, because it's really very good for a woman, how she is getting menstruation. If through this menstruation ovum release, then sperm get fertilized through this ovum gets fertilized through this ovum, then how mothers gets pregnant, how this baby slowly growing inside a female body. It's really an amazing event for all female, right? So that's all about your luteal phase. Okay, so if I ask you, luteal phase is dominated by which hormone? What will be your answer? This progesterone is the main hormone. If I ask you what is the dominant hormone in follicular phase, your answer was estrogen. But in luteal phase, what is the main dominant hormone? Your answer will be progesterone. Corpus luteum secretes which hormone mainly? Mainly progesterone. Along with that, it secretes estrogen and inhibin also, but main hormone is progesterone. Okay. If I ask you, this hormone responsible for endometrial secretory changes. This secretory change means in luteal phase which hormone? Indirectly, they are asking this luteal phase which hormone is mainly responsible during secretory phase. Answer will be your progesterone. Okay. So endometrial changes in luteal phase prepare for. If I ask you, endometrial changes in luteal phase prepare for what? Prepare for your implantation. Okay. If once this ovum released and it gets fertilized by sperm, then it makes the zygote. If it makes the zygote, then it needs implantation in uterus. As a result, this woman will throughout the pregnancy, it needs supports in uterus. For that, progesterone is important. So this implantation is needed. During implantation is the main events after the fertilization occurs. So endometrial changes in luteal phase prepare a mother uterus for implantations. Understood? Then if I ask you the constant phase of menstrual cycle, again your answer will be your luteal phase. If I ask you variable phase of menstrual cycle, your answer was follicular phase. So this is the constant phase. Okay, constant phase. If I ask you the main hormone in pregnancy, again your answer will be progesterone hormone. P for pregnancy, P for progesterone. Okay, so that's all about your luteal phase. So we will enlisted all questions here again. Okay, luteal phase is dominant by which hormone? Progesterone. Okay, so there is total two, mainly D14, right? This is D1, this is D28. D1 to D13 is your follicular phase, and the main hormone was estrogen. Okay, D15 to D28 is your luteal phase or secretory phase, and the main hormone is your progesterone. Understood? So hormone responsible for endometrial secretory changes, again progesterone. Okay, progesterone. Corpus luteum secretes which hormone mainly? Answer will be your progesterone. Okay, this corpus luteum secretes progesterone, secretes estrogen, secretes inhibin in little amount, but progesterone is the main hormone. In large amount of progesterone secretes from your corpus luteum. Endometrial changes in luteal phase prepare for your implantation. Which hormone maintains this early pregnancy? Your answer will be your progesterone. In early pregnancy, progesterone. In later pregnancy, HCG. Okay. Which hormonal axis regulates the menstrual cycle? Again, this HPO axis. Once the female attains puberty, this puberty, then HPO axis gets activated. Okay. Then hypothalamus secretes GnRH sends message to anterior pituitary secretes FSH, LH acts on ovary secretes estrogen and progesterone, and like in this way whole menstrual cycle is regulated through this HPO axis. Under the stress or weight loss or excessive workout, some female will complain that I am not getting period in this month. I am not having any bleeding phase. I didn't get any bleeding phase or menstruation phase in this month. Why? Because if a female undergoing excessive stress, if a woman will be having weight loss or excessive workout or exam stress, then the female will be complaining of my period get missed. Okay, why? Because this under stress cortisol will release, right? Stress hormone. This cortisol is having inhibitory effect on FSH, GnRH. If cortisol secretes and it's showing its inhibitory effect on GnRH, then GnRH secretes in less amount. If there is GnRH secretes less amount, then from anterior pituitary less amount of FSH and LH will be released. As a result, ovary will also release less amount of estrogen and progesterone. As a result, on that particular month, female will be having missed period. Okay, amenorrhea means what? Amenorrhea means absence of menstruation, that we will cover in disorder of menstruation. Okay, so here we enlisted total 32 questions in phase wise, and I think this is enough for you all to prepare your menstrual cycles topic. Okay, so that's all about this menstruation and important one-liner questions. I hope it's clear, and prepare yourselves for your upcoming Norcet 9. So thank you.